Hi, my name is Brittany Moore. I am recording my week 1 health history and risk assessment video for MSN 572. Today is October 12th, 2025, and I will start with my room scan and just showing my computer. There is my computer screen. And then I do have notes. These are the notes from the online classroom, the blank worksheet. There's, I'm really struggling. That and that. And then nothing on my clipboard. And then my room scan. So I do have my computer on this little stand. There's nothing on it. This is the wall. And then this is a little shelving unit next to me. And there is nothing on my table except my notes. And then just down this hallway is a mess. Let me just plug my computer in before I get started. Make sure that's right. All right. Hello. How are you today?
I'm well.
That's great. My name is Brittany Moore. I'm a nurse practitioner student with United States University, and I will be helping you out today.
Okay.
Before we get started, I just need to let you know that I will be recording a video of our time together, and I will be uploading it to YouTube as unlisted. It's so my professors can view it and grade it. Can I get your consent to record this?
Sure.
Wonderful. All right. Let's get started. As we go through this, I'll be taking some notes just so I can remember for the after visit summary. But if you have any questions, please let me know. Okay?
Mm-hmm.
All right, let's start with your first and last name and your birthday.
Derek Moore, 7/4/82.
All right, Derek Moore, 7/4/82. And that makes you how old?
43.
And then what is your race and your ethnicity?
White, not Hispanic.
All right, white, non-Hispanic. And what is your gender?
Male.
And is that the same gender at birth?
Yes.
Thank you. And then can you tell me, how did you come to the clinic today? Did you walk? Did you drive?
I drove.
Okay. And did you come alone or did you come with someone?
Alone.
And then can you tell me the reason for your visit today?
The annual wellness check.
Okay. An annual wellness check. And do you have any health concerns that you would like to address today during this visit?
I don't.
Okay. All right, well then let's get started. So with this, I'll go over some previous visits, some screenings, and then we'll go into some medical history, social history, hobbies, habits, and then some family history, okay?
Mm-hmm.
If you have any questions along the way, please feel free to ask, okay?
Okay.
All right, so let's start with the date of your last wellness exam or your last physical. So the month and the year.
July of 24.
Okay. And during that wellness exam, do you recall if you had any screenings done?
I did.
Okay. Do you know what you have done?
I had lipid and A1C
Okay.
analysis.
Your lipid and A1C. And do you recall what the results of those were?
Everything was healthy range.
Okay. And do you happen to know the exact numbers?
I don't.
Okay, no worries. And have you ever been screened for anything like hepatitis C or HIV?
No.
Okay. So those are two things that we screen for. It's recommended to have them done at least once in a lifetime. So if it's something that you're interested in, we can get that done today.
Okay.
All right. And what about any blood pressure checks at home?
None.
Okay. And do you know what your average blood pressure readings are?
I don't know.
And I only ask those questions just not to scare you or anything, but blood pressure or hypertension, high blood pressure, is a condition that often happens without any symptoms. By the time symptoms start happening, damage can already be done, or it can already be somewhat problematic. So we just like to keep track of where you're at. But we do check your blood pressure in the clinic, and at most of your visits you should have your blood pressure checked. So we'll trend it that way.
Okay.
And then have you ever been tested for any sexually transmitted infections?
No.
Okay. All right. Let's move on to some other previous exams that you've had. So can you tell me the month and the year of your last eye exam?
July of 24.
Okay. And what was the result of your eye exam?
Everything was normal, no concerns.
Okay. And do you wear contacts or glasses?
No.
Okay. And what about the month and the year of your last dental exam?
This month, October 25.
Okay. And how was your dental exam?
Good. No issues.
Okay. And are you seeing the dentist and the eye doctor on a regular basis?
Yeah, annually.
Great. Perfect. All right, we'll move into some past medical history. Can you tell me about any current chronic conditions that you manage? This could be anything like hypertension, diabetes, hypothyroid.
None.
Okay. Have you ever had any serious illnesses as an adult?
No.
Okay. And what about any childhood illnesses? So this could be things like whooping cough, chicken pox, rheumatic fever, frequent strep throat. Okay. So no childhood illnesses. And then any chronic childhood conditions like asthma or anything like that?
No.
Okay. All right. And then how about any psychiatric history? Have you ever had any diagnosis of a psychiatric form like anxiety, depression?
No.
Okay. And then tell me about any past hospitalization.
None. Just sports injuries that required surgery. That was same day surgeries.
Okay, so no overnight stays.
No.
And then just same day surgery. Can you tell me a little bit about the surgeries that you had?
I had a left Achilles tendon repair back in April of 2017.
Okay.
And then more recently, my left rotator cuff was surgically repaired October of 24.
Okay. How do you feel like you're doing with those? It's been a few years since your Achilles tendon rupture. How's that?
Everything feels back to baseline for the most part.
Great. No limitations or no complications with it?
No.
Okay. As far as the surgery goes, any complications with the actual surgery or with any of the anesthesia?
No issues, and afterwards surgeon said it went well, so
Oh, good. Okay.
yeah, no problems.
And then same with that rotator cuff. Any complications
No.
with that? No complications with anesthesia?
No. Went well.
Well, that's good, and I'm glad to hear that you're back to your baseline.
Thank you.
Okay, well, let's go ahead and move into some immunization history.
Okay.
First, we'll talk about childhood immunizations. Do you recall any of like the dates that you had any of your childhood immunizations? I know it's kind of going back a little ways, but things like your MMR, which is the measles, mumps, rubella, the Tdap, which is the tetanus, diphtheria, and pertussis, polio.
I don't recall any of the dates, but I know my parents followed the recommended vaccine schedule for my age.
Okay.
And then I go to the doctor annually as an adult.
Okay.
Check for all the scheduling and make sure I'm in compliance.
Okay. So it sounds like you're up to date on your
I think
immunizations.
so, yeah.
Okay. So every year we suggest all of our patients get the annual influenza vaccine. Do you know the month and the year of your last influenza vaccine?
Yeah, I had it this month.
Oh, perfect. Okay. And of this year, just
Yeah.
to confirm. Okay. Influenza. And then, what about your COVID vaccine? Are you COVID vaccinated?
I had it back winter of 2020.
Okay. Do you recall what month?
I think maybe December
Okay.
of 2020.
And do you recall what vaccine you had at that time? There were probably Johnson & Johnson, Pfizer, and Moderna.
I think I had the Pfizer.
Okay.
But never any boosters or anything like that, just the one time.
Okay. All right. And then what about a tetanus shot? Do you know when the last time you had a tetanus shot was?
I think about 4 years ago.
Okay. And if you had to guess on an actual month and a year, what would you say?
Just
Unknown.
maybe 2021 is a year.
Okay.
But unknown for the month.
All right. So with the tetanus booster, it's important to have, if you were to have a metal injury, the booster is recommended to have every 10 years for protection. If you have a metal injury when you're 5 years out from your booster, then we would recommend that you have another one. So even though that would be considered early on the schedule, we would prefer that you have it early so that way you're safe if there's any sort of a metal injury.
Okay.
All right. Let's move into prescription medications, over-the-counter medications. So this category will be prescriptions, over-the-counters, herbal supplements, herbal remedies, vitamins, minerals, anything like that. Can you tell me about any medications that you take?
The only thing I regularly take is men's 1 a day daily multivitamin. It's just 1 pill orally every day.
Okay. All right. So the men's 1 a day daily and just 1 pill orally every day.
Mm-hmm.
All right. And then what's the reason that you're taking that?
Just to ensure I get enough vitamins in my diet.
Okay. Have you ever been told that you're low on any vitamins?
No.
Okay. Let's move down to allergies. Can you tell me about any history that you have with allergies?
I have a penicillin allergy.
Okay. And what happens? What's the reaction?
I had a slight skin irritation on my chest.
Okay. And do you recall requiring any treatment for that?
Not that I was very young. And
Okay.
Once my mom noticed, we just discontinued use, and I didn't have any complications after that.
Okay, that's great. So that's a medication allergy. I'm also interested to know, do you have any food allergies?
None.
Okay. And then what about any environmental allergies?
None.
Okay. All right. All right, so we've gone through past medical history, psychiatric history, or hospitalizations. Overall, how do you feel about your health?
Pretty good.
Good. That's good. All right, so this next section is some family history.
Okay.
So this is just to give you kind of a background so you understand. So there are certain diseases or conditions that can run in families, and so if there's a genetic risk factor, we always like to know so that way we can start screening for them, or we can kind of be on the lookout for it, okay?
Sure.
It doesn't automatically mean if your family member had this that you're going to develop it, but at least it puts it on our radar, okay?
Mm-hmm.
So I'll be asking questions about children, siblings, parents, and grandparents, and I just have questions about if they're alive, if they're deceased, if they're no longer alive, how old were they when they passed away, if you know what they passed away from, and then if you know about any medical history that they had while they were alive.
Okay.
So it's kind of a lot, but just do your best, okay? So we'll start. First, do you have any children?
I have a 11-year-old son.
Okay. 11-year-old son. And does your son have any health conditions?
No.
Okay. And then siblings. Do you have any siblings?
No.
All right. What about your mother?
Deceased.
All right. And how old was she when she passed away?
42.
And do you know what she passed away from?
Auto accident.
Okay. And what about any health conditions while she was alive?
None.
Okay. What about your father?
Deceased.
Okay. And do you know how old he was when he passed away?
53.
And do you know what he passed away from?
Pancreatic cancer.
And any other health conditions you know of that you...
I was aware of.
Okay. And then your maternal grandmother, is she alive or is she
Deceased.
Okay. And do you know how old she was when she passed away?
No.
Okay. And do you know what she passed away from?
No.
And any health concerns while she was alive?
Not that I'm aware of, no.
Okay. And then your maternal grandfather?
Deceased.
Okay. And then do you know how old he was when he passed away?
No.
And what about any, do you know what he passed away from?
I don't know.
And then any medical conditions while he was alive?
Not that I'm aware of.
Alright, and then your paternal grandmother?
Deceased.
Alright, do you know how old she was when she passed away?
I don't know.
And do you know what she passed away from?
I don't know.
And then do you know about any medical history while she was alive?
None that I'm aware of.
Alright. And then your paternal grandfather?
Deceased.
Alright, and do you know what age?
I don't know.
Okay, and do you know what he passed away from?
I don't know.
And any medical history while he was living?
Diabetes.
Alright. Thank you. I know those can be hard to answer, just sensitive questions, so thank you for answering those.
Sure.
Okay, so moving on, I'd like to talk to you about some habits that you may have. So I'd like to ask you about any history that you have with tobacco use. Any history with tobacco use or any nicotine products, so this could include smoking cigarettes, cigars, vaping, or even the smokeless tobacco products like chew or the pouches.
None. Never used.
Okay, none and never used.
Mm-mm.
Alright, that's good. Your lungs will be very happy with you,
Mhm.
and your mouth will be very happy with you. What about alcohol use? Can you tell me about any alcohol use?
Weekly use.
Alright, and going on a daily scale, how many days per week are you drinking?
About 2 for the weekend.
Okay, and how many drinks per day are you consuming?
2 to 4.
Okay, and what's the reason why you're drinking?
Relaxation.
Okay, and do you feel like you have any problems with alcohol?
No.
Okay. What about caffeine use? So this can also, just before you answer, can include coffee, tea, soda, energy drinks, or even like pre-workout type supplements that have caffeine in them.
Daily coffee
Okay.
and no other intake. Probably about 2 to 4 cups of coffee per day in the morning.
Okay. 2 to 4 cups of coffee per day in the morning. All right. And what about your history with any illicit or recreational drug use? This could include prior substances like marijuana, methamphetamine, cocaine. It's also not limited to those, but anything of that nature.
No, never used.
Okay, and never used. Wonderful. Okay, so let's move into some social history. So your marital history. So can you tell me about your relationship status?
My wife and I have been married for over 10 years now.
Okay, that's great. And how would you describe your marriage?
It's well, yeah, going great.
That's good. And do you have any concerns about being safe at home? Is there any history of domestic violence or partner violence?
No, no issues.
Okay. All right. And can you tell me about your current housing situation or living situation?
My wife and my son, we live in our house
All right.
together.
You live in a house with your wife and your son. Do you have any concerns about losing housing or not having utilities or anything like that?
No.
Okay. All right. What about a support system? If you were feeling stress or you needed someone to lean on, talk to me about who you have kind of in your corner for support.
Just friends and family.
Okay. Aside from the family that you live with, do you have any family that lives nearby?
In California, neighboring state.
Okay.
So, but we can communicate in social media and cell phone stuff.
That's good. We definitely have communication possibilities these days.
Mm-hmm.
All right, I would like to talk to you about your sexual history. This is just to make sure that you're of utmost help. If you have any questions, please let me know. So first, is your sexual orientation?
Heterosexual.
Okay. And have you had any issues with infertility?
No.
Okay. And do you have any sexual dysfunction?
No.
Okay. And in the last 6 months, how many partners have you been with?
One.
All right. And are you actively, are you and your wife talking about having any more children?
No.
Okay. Then are you doing anything to prevent becoming pregnant?
No.
Okay. And then what about any protection against sexually transmitted infections?
No.
Okay. Any history of sexually transmitted infections?
No.
Okay. And as far as partners in practice, what's the gender of partner that you prefer to be with?
Female.
And what type of sexual practices do you engage in?
Traditional.
All right. I think that wraps up that section. Tell me a little bit about what you do for work.
I'm in retail.
Okay. And tell me about your job. Do you have job satisfaction? Do you have job security?
Yeah, I enjoy my job, and I've been there almost 10 years now.
Okay. How about any occupational hazards? Are you around any sort of like chemicals or anything dangerous that may put you at risk for injury or illness?
No.
Okay. Okay, that's good. What about driving for work? Do you drive for work ever?
Yeah, I commute to and from work.
Okay. When you're in the car, how do you stay safe?
Wear my seatbelt, stay off the cell phone, pay
Okay.
attention to my surroundings.
That is good. Cell phones and texting and driving are so dangerous. All right. What about work stress?
Just manageable,
Okay.
mild.
And then what about just your life stressors?
Same, just mild here and there, but all manageable.
And what about coping mechanisms for your stress? Do you have coping mechanisms?
Working out, watching funny movies, going outside, hiking, fishing, stuff like that.
Nice. Well, we have some really great fishing around here, and we have some really great hiking too.
Mm-hmm.
Did you ever go up to Strawberry to go fishing?
I do.
Yeah, it's nice up there. All right. What about your diet? Can you talk to me about what type of diet you follow?
I don't follow a specific diet, but usually have like a light breakfast, a snack, or no lunch while I'm at work,
Okay.
and then when I come home, we'll have like a family dinner.
How many days per week are you eating red meat?
Anywhere from 1 to 4.
Okay. And then what about eating fast food? How many times per week are you eating fast food?
0 to 1
Okay.
time a week.
Okay. That's good. That'll really cut down on like processed foods and sodium consumption and all of that. Speaking of sodium, how is your sodium consumption?
Probably average.
Okay.
Cook at home, so just add it to taste and
Okay.
nothing excessive.
What about how much water are you drinking per day?
Probably about 64 ounces.
Okay. All right, that's great. What about fruits and vegetables?
Probably 2 servings a day
Okay,
of each.
that's good. Vegetables are really good dietary fiber, so it helps just to move things through your digestive tract. And then your water intake is good for all of our systems. It'll also keep your kidneys pretty happy.
Okay.
How about exercise? Can you talk to me about what you do for exercise?
Weight training,
Okay,
anywhere from 2 to 5 times a week.
okay,
And then as a warm up, I'll do 30 minutes of cardio on like a treadmill.
okay. And
That's 2 to 5 times a week as well.
okay, so 30 minutes of cardio 2 to 5 times per week.
Mm-hmm.
And then what about how long are you working out when you're weight training? Like at the duration of your exercise?
1 hour.
Okay. 1 hour. Great. What about your sleep? Can you talk to me about your sleep habits and sleep health?
I usually go to bed pretty early and sleep about 6 to 7 hours per night.
Okay. Do you have any difficulty falling asleep?
No.
Do you have any difficulty with staying asleep once you've fallen asleep?
No.
Okay. And what about, do you feel well rested when you wake up in the morning, or do you feel groggy?
Rested.
Good. All right. And do you take any sleep aids?
No.
Good. All right. How about any military history?
None.
And what about any spiritual affiliation?
None.
Okay. Do you consider yourself religious or spiritual at all?
No.
Okay. What types of things in your life give your life meaning or purpose?
Just family.
Okay. And then outside of work, what do you like to do for fun?
Hiking, fishing, weight training.
Okay.
And traveling with my family.
Okay. Where do you like to travel to?
Anything with the beach.
We don't have those around here, so sounds like a lot of your coping mechanisms are also your hobbies, so that's great. Okay, well, when you are doing any of these activities, how do you keep yourself safe? So how do you keep yourself safe when you're hiking and you're out in the sun?
You should wear like a large hat and then like a UV resistant long sleeve shirt with a hood.
Okay.
If I'm swimming, then I'll usually apply sunscreen
Okay.
prior. Preference is just to wear layers though over the sunscreen.
Understandable. What about any life jackets when you're out fishing? Do you wear a life jacket for fishing?
If I'm on the water.
Okay.
I usually just shore fish. So.
Okay. All right. Do you ever ride a bike?
Rarely.
Okay. If you were to ride a bike, do you wear a helmet?
I would, yeah.
Okay. And then do you have any guns in the home?
No.
Okay. And if you had any guns, we just want to make sure that they're unloaded and they're locked up where they can't be accessed by people that shouldn't access them. What about any disabilities? Do you have any disabilities, or do you need any assistance completing your just everyday tasks, like your activities of daily living, grocery shopping, cleaning?
No.
Okay. All right. The next set of questions is just a bunch of yes or no questions. It's just going to go kind of top to bottom. So I'll just have you answer if you have these currently or if you have had them in the past. Okay?
Okay.
So just your overall. How about any fevers or chills?
No.
Okay. Or what about weakness or fatigue?
No.
Okay. Any weight changes?
No.
Okay. And talking about your eyes, any eye pain, visual changes, so that could be things like tunnel vision, blurry vision, floaters, or any drainage.
No.
Okay. Ears, any ear changes or hearing changes, use of hearing aids, ear pain or ear drainage.
No.
Okay. And then nose, so any congestion, differences in smelling or difficulty smelling, sinus pressure, congestion.
Nothing.
Okay. And then for throat and mouth, so any tooth pain, any ulcers or lesions in your mouth,
No.
hoarseness, sore throat, dry mouth.
No.
Any difficulty chewing and swallowing food.
No.
Okay. And then cardiovascular, so any chest pain with or without exertion.
No.
Okay. Any abnormal heartbeats.
No.
Any swelling.
No.
Any history of blood clots in your legs or in your chest.
No.
Okay. Respiratory, any history of any lung diseases.
No.
Difficulty breathing.
No.
Wheezing.
No.
Okay. Any cough or any sputum, coughing up phlegm.
No.
Okay. Gastrointestinal, are you having bowel movements daily?
Yes.
Any laxative use?
No.
Any abdominal pain?
No.
Any blood in your stool?
No.
Any nausea, vomiting, or diarrhea?
No.
Okay. For genitourinary, so that's your urinary tract, any history of kidney stones?
No.
Any frequency with urination?
No.
Painful urination?
No.
Dribbling?
No.
And what about your stream? So your urine stream, have you noticed any changes with that, the force of that?
No.
Okay. And then musculoskeletal, any range of motion difficulties?
No.
Any broken bones?
Yes.
Okay, what did you break?
I broke my arms when I was maybe 10.
Okay. One arm or both arms?
Both.
Oh, at the same time?
Mm-hmm.
How did you do that?
Falling off a roof.
Oh, okay. So approximately 10 years old. That must have been rough. Short cast or tall cast?
I think it was the full cast.
All right. Well, I'm glad to see better. I know that was a while ago, but any other broken bones?
No.
Okay. So any joint pain?
No.
Joint swelling?
No.
Stiffness?
No.
All right, and then integumentary, so your skin, any new moles?
No.
Changes to existing moles?
No.
All right, any rashes? Excessively dry skin?
No.
All right, and then we always ask both men and women about breast health, just because men can get breast cancer too. Some people don't know that, but men also are susceptible to getting it. So have you ever noticed any like lumps, nodules, anything hard in your breast tissue or any nipple discharge?
No.
Okay. Any headaches?
No.
Any seizures?
No.
Any tremors?
No.
Any numbness or tingling? Kind of like that pins and needles feeling in your hands or feet?
Oh.
Okay. Any anxiety?
No.
Depression?
No.
Any bipolar? Or any hallucinations?
No.
Okay. And then any heat intolerance?
No.
Cold intolerance?
No.
All right. Any excessive sweating?
No.
Excessive thirst?
No.
Or excessive urination?
No.
Okay. Any easy bruising?
No.
Any excessive bleeding?
No.
Or any blood disorders like anemia?
No.
Okay. Any swollen lymph nodes or glands?
No.
Any prolonged illnesses?
No.
Any difficulty getting over an illness?
No.
Okay. And then any allergies?
Penicillin.
Penicillin. And then any food allergies?
No.
No. And then no environmental allergies, correct?
No environment.
Okay. Any history of psoriasis?
Mm-mm.
Any history of lupus?
No.
Or any eczema?
No.
Okay. I think that about covers it. Let me just double check and make sure I didn't miss anything. I think we got everything. Do you have any questions?
No.
Okay, the last question, the one thing I was going to ask you about was going back into your sexual history. Or more reproductive health. Do you ever engage in any monthly testicular self-exams?
No.
Okay. Do you know what they are, why to do them, or how to do them?
Yes.
Okay. So just remember when you're doing those, you're looking for those hard nodules, changes in shape and size, and you'll want to do that when your skin is warm. So either in the shower or right after the shower. Okay?
Okay.
All right. I think that was everything. Do you have any questions?
No.
Okay. Well, it was really nice to meet you. Thank you so much for your time.
Thank you.
I don't like that it turns off.